Hi, I'm Dr. Dennis Lenslink. I'd like to take a few moments and talk to you about low back pain and how it associates with problems that people will come in with affecting their hips, their knees, their ankles, their feet, things such as sciatica, anything that you'd associate all the way down, even the plantar fasciitis, which is pain in the bottom of your feet, which is a very disabling pain as well. What's the common denominator to all these issues? Well, as we talked about before in the neck, the nerve supply of the neck controls everything through the shoulders and upper back. Everything from about here down, about the 12th thoracic or first lumbar level, there's 5 vertebrae that make up the lower lumbar spine. Then you have your pelvis and hips. The nerves that come out of here control all the function of your organs in your lower intestine, your sexual organs, all the muscles in your hips, your legs, and your feet. So when we come in to somebody who's got lower back pain, yes, we're going to look at the low back here. We want to observe what are the shape of the curves in the spine, just like we did in the neck. There should be a C-shaped curve back here. Is there a lot of muscle spasm in the back? Are they leaning forward when they come in? They can't straighten up. That's a clue that maybe there's a problem with a joint or a disc. If we turn them a little bit here, sometimes people will come in and they're leaning to one side or the other. They're very distorted. That's usually a good clue or indication that there's a problem in one of the joints or discs in the lower back. That can also cause shooting pain that you would call sciatica down your leg. How severe that is sort of depends on how far down the leg it goes. It could stop here, it could be all the way down into the foot. So we're going to have to take all those things into account. Now people come in to chiropractors like myself thinking about back pain. And they're thinking, okay, I got a compressed nerve. The thing they aren't thinking of is what other organs do those nerves go to? These lower back nerves, as I said, control your digestive system. So a lot of times when you come in with low back pain, you may have problems in your stomach or lower bowel. Now here's the real silent tragedy. People can have nerve compression or irritation all the time, but you don't have lower back pain, you don't have leg pain. But you may be having menstrual cramps, PMS, sexual dysfunctions, all kinds of problems with bloating, Crohn's, colitis, all kinds of things with hemorrhoids even, things that you wouldn't normally associate with a chiropractor. But these internal organ problems or vascular problems can have a direct tracing back to the spinal nerves if these nerves are not functioning well or being irritated. So as a chiropractor, again, we're taking all these areas into account to see how is it affecting your overall life. So the worst thing you can do is make the assumption, if I have no pain, I have no problem. In our office, we have specialized tools to actually determine how well your nervous system is working. We can actually come up with a computer instrument that as we scan your spine, it'll tell us electrically, just like a circuit tester on an electrical circuit, how hard the muscles and nerves are working, if there's a short in one of those basically. We have gauges that measure how sensitive your pressure is. We have another gauge that measures the temperature. That's a direct correlation to how well or not well your internal organs are working. We then combine it with range of motion and can come up with a single number that tells us what your overall wellness and functional ability of your body is. So on a scale of 1 to 100, say you want to be over 85 to have very good health. If you score 15 or 20, you've got a long way to go. And the other situation is you could have absolutely no back pain. So people tend to equate their overall health to whether they're having pain or not. This is where I referred back to situations such as a heart attack. I've known patients who have passed their physical and the next day they died of a heart attack, but they were considered in perfect health when they had the physical. So there's many ways of trying to determine your overall health. Right now we're trying to pay particular attention to your low back and the special things we can do to make you feel and function better.